Hello, my name is Dr. Theodore Kuo. I am a Pediatric Emergency Medicine Fellow at Johns Hopkins Children's Center, and I will be talking today about my paper in the Journal of Developmental and Behavioral Pediatrics titled Assessing Ease of Delivering Emergency Care for Patients with Autism Spectrum Disorders. The emergency department can be a highly stimulating and stressful environment for children with autism. This is especially pertinent given the increasing incidence of autism spectrum disorders, with 1 in 59 individuals being diagnosed in the U.S. annually. Because of the intrinsically stressful environment in the ED, providing optimal care for these patients can be challenging. In addition, individuals with ASD utilize the ED at higher frequencies than typically developing individuals. To date, studies have relied heavily on survey data to assess care that is provided to children with ASD in the emergency department. However, survey data can also be influenced by factors not directly related to medical care, such as long wait times and customer service. Therefore, we sought to answer the question, do patients with ASD experience more inefficient and disrupted care while in the ED than their neurotypical peers? To answer this question, we developed an objective scoring metric to assess the delivery of care in 5 domains critical for the medical evaluation of patients in the ED. These domains include triage vitals, imaging, phlebotomy, RN procedures, and overall plan of care. Points were assigned if patients met any of the following criteria, and then summed to devise a task completion score. Because medical workups vary from patient to patient, and not all patients will require imaging, phlebotomy, or RN procedures, we normalize the task completion score to a task completion index by dividing the total score by the number of domains the patient was exposed to. This index was then ranked from a scale of low, moderate, high, or severe. We retrospectively reviewed emergency department records of patients with ASD and their neurotypical controls from visits in January 2016 to January 2018. Neurotypical controls were matched to patients with ASD based on age, sex, race, chief complaint or visit diagnosis, and procedures received while in the ED. Because we wanted to focus on the delivery of medical care, patients being seen for mental health concerns were excluded. Interrelater reliability of the score was established by scoring of 50 patients independently by a second reviewer to derive a kappa coefficient of 0.927. We found a statistically significant difference in the overall TCI of patients with ASD when compared to their neurotypical controls. Patients with ASD had a median TCI of 0.25, while neurotypical controls had a median score of 0. In addition, we found that patients with ASD had significantly increased odds of not tolerating triage vitals, requiring additional staff for peripheral IV placement, and having an interruption to their overall plan of care. To summarize, we found that children with ASD have higher TCIs than neurotypical controls, which puts them at higher risk for care disruptions. The TCI can be used as an objective metric to monitor progress in quality improvement efforts to improve delivery of care to patients with ASD and other developmental disabilities. The TCI can also be used to identify patients who may benefit from proactive behavioral interventions during future ED encounters. This concludes my video abstract. Thank you very much for listening.